Hello and welcome. My name is Angélica and I am the co-director of the Specialized Center for Stuttering. And today I am here with Dr. Christopher Constantino. Hello, Chris.
Hello, nice talking to you again.
Nice to see you here. Well, first of all, I would like to ask you if you could please introduce yourself and tell us a bit more about you.
My name is Chris Constantino. I'm a speech language pathologist and an assistant professor. I work at Florida State University where I do clinical supervision, teach classes, and do research. I teach the stuttering and counseling classes. All of my clinical work is in stuttering. I think I'm a pretty good stuttering therapist, but you probably don't want me for anything else. And my research looks at how to improve the experience of stuttering. So if we're going to be stuttering, how do we stutter and enjoy that experience as much as possible?
Yeah, yes. And I really like that approach because I'm also a person who stutters. So I don't know, I think during my experience and and as you also mentioned it in I don't know if an article or another interview, it was just society they don't accept our way to talk, and so it's normal to have a lot of feelings of I shouldn't talk in this way, and there's also a conflict with our identity about I am a person who stutters, but I don't want to be a person who stutters, so I try to be fluent in a lot of things that we need to work on in therapy. But the reason and the main topic that we are going to talk today is spontaneity and stuttering. Could you please tell us a bit more about what is spontaneity?
Mm-hmm. Yeah, this is going to be a long explanation because I want to. Okay. So when we talk about stuttering and we're trying to describe it, we're often describing the presence or absence of disfluencies and the types of disfluencies that people have. And so our description is very listener based. And the problem with that is that stuttering is not the behavior, it's the feeling, right? Stuttering is the feeling of being stuck. It's the feeling of losing control. And so somebody might react to that feeling by trying to fight through that feeling of stuckness, and you might see a block or a prolongation. They might also react to that feeling by switching words. And so they had a moment of stuttering, but there was no disfluency. You didn't see it, you didn't hear it. And so I was interested in a way of describing the experience of stuttering that was from the speaker's perspective, not from the listener's perspective. I was also interested in distinguishing between several experiences. And so you have the experience of fluent speech, right? So like normally fluent speech, where a person is speaking, they're not having to think about physical speech production. They are probably thinking about language. They're probably thinking about making a good impression. They might be nervous about whether they're being funny or smart or if their hair looks okay, right? But they're not thinking about how do I get from this sound to the next sound, right? The physical aspect of speech happens quite automatically for a fluent speaker and for a person who stutters when they're speaking fluently, right? Distinct from that experience is the experience of using fluency shaping, right? Where the person speaking might sound fluent, but they're actually having to think about and concentrate on speech production, right? So it might sound the same, but it feels very, very different. A third behavior I wanted to experience of speaking I wanted to distinguish was the experience of passing as fluent, so covertly stuttering. Similar to fluency shaping, the listener might not hear stuttering, but the person is doing a lot of work under the surface. They're having to predict what words they might stutter on and come up with synonyms, come up with alternatives. And then a fourth, or a fourth experience of speaking is struggled stuttering, right? You're stuck. You're trying to get yourself unstuck. You're putting a lot of effort into moving through your sounds. And so what distinguishes all of these are not necessarily the presence or absence of disfluencies, but the presence or absence of attention and effort on speech. So I sort of envisioned this 4-quadrant model where you have on one axis, let's say the y-axis, fluency and disfluency. So whether the person is producing audible disfluencies or whether they're not. And then on the x-axis, easy attentionless speech, which I call spontaneous speech, or effortful attention demanding speech. And so if you think about all those experiences I just described, a typically fluent speaker, their speech both sounds fluent and is experienced as spontaneous. They're not having to think about it. They're not having to put effort into physical speech production. A person who's passing as fluent, or a person who's using fluency shaping, their speech might sound fluent, but it's not spontaneous. They're having to think quite a bit about it, put in mental, sometimes physical effort to produce that fluent speech. A person who's struggling with their stuttering are both disfluent and not spontaneous because they're producing disfluencies, and those disfluencies are causing them to get stuck in such a way that they need to direct mental attention and physical effort to get unstuck, right? So they're pushing through blocks, they're really tense, they're struggling. Somebody who's stuttering sort of easily and with little need to react to those moments of stuttering might be disfluent, but they're fairly spontaneous, right? They're not having to unstuck themselves, right? Their moments of stuttering are happening, but they have very little reaction and they just sort of move through them. And so the idea of spontaneity was to help me to, I guess, distinguish between what's important about our speaking experience. When we're thinking about speech therapy, is the outcome we want to be fluent at all costs, even if it means having non-spontaneous speech, effortful speech? Or is what's more important that subjective experience of ease of speech? And so that's what some of my research has looked at. And
I really enjoy when I read that paper or that article, because yeah, I find it really interesting because it made totally sense. It's like, I don't know, there's always this approach of, yeah, you just need to practice your speech technique, your cancellation, your, I don't know, pull out. And if you do this, then you will speak with spontaneity. And I mean, there was always that message, but then it's like, okay, it's not exactly like that, because those speech techniques, I mean, nothing wrong with them, um, but it's like, it's not the way that we are going to speak freely all the time, because it requires effort. And that's something that I also like to mention, because, well, I'm sure that you also have that when, I don't know, you see or you are doing a presentation about stuttering, a lot of people just started to text in the chat, what are the speech techniques, what are the tools and things like that. And you're like, wait, the tools is not the most important part of the therapy. They can work for some people, for others not that much, but the goal is for the person to speak with spontaneity, speak, to be free with that. And I mean, there are other ways where we can work on that. It's not exactly just speech techniques.
Yeah, and I think people want something that's easy to wrap their heads around, right? And so I think that's actually a big attraction of fluency shaping, is that it's easy to teach, right? That pedagogically, it's easy to explain. And so the idea of, okay, stretch your syllables out and connect them one to the next is easy to demonstrate and easy to explain. So is, say, talking in time with a metronome or voicing all the time. But a lot of, like, if you're doing avoidance reduction therapy or like traditional stuttering modification therapy, those are actually quite abstract, right? And it's hard to explain. It takes time, and it takes experiencing different ways of speaking and play. I think it can be, therapy can be a lot of fun, actually, if we're helping people to explore, this is what happens when I react to stuttering this way. This is what happens when I react this other way. And actually reacting this way requires less effort than reacting that other way. And it's not as straightforward, and it takes longer.
Oh.
But the result of, I think, in general, lessening our reactions to stuttering and learning to move into the moments of stuttering tends to be more spontaneity. And what my research has demonstrated is that fluency does not predict negative life impact. So if you look at how fluent a person who stutters is, it's hard to use that to predict their score in the OASIS on the overall assessment of speakers' experience of stuttering. However, how spontaneous they feel significantly predicts life impact. And the more spontaneous they are, the less they're negatively affected by stuttering. And so that seems to be the more important outcome. I think it's harder to achieve because it's more abstract, it takes more time, but I think it's worthwhile.
Yeah, and it gives us results in the long term.
Right.
Which is what we want at the end. Like when I work with my clients, I mean, I am a psychologist right now. I'm just studying to be a speech therapist also, but so I don't work directly with, I don't know, cancellation or pull-out, because I'm not a speech therapist. But actually I enjoy only working with a psychological impact, because that what will give them the, I don't know, the freedom in the long term. And I always try to explain that, yeah, I mean, I know that it's easy to think, yeah, I'm talking this way. If I learn speech techniques, then my life will be better, will be solved. But it's like, just let's be a bit more patient and try to understand that before working on that, we need to first work in other things, like to diminish, as you were saying, the reaction and how I react to this sense of loss of control, which is, at the end, I mean, what is going to stay and the change that we are going to see in the long term. And another another thing that I wanted to mention, because I know that there could be also some confusion or some, yeah, I mean, it could be a bit confused when we talk about this topic of spontaneity. It's like, because sometimes I have heard things like, well, but if a person stutters a lot, is that being spontaneous, and things like that, like, could be, I don't know, for some people could be confusing.
Yeah, I think sometimes, often actually, stuttering can make speech less spontaneous, right? And so, like, it's not just about just stutter and don't do anything, right? Because if I'm stuck, if every time I go to speak I get stuck, I'm also not being very spontaneous, right? Because it takes effort to get unstuck. And so I'm much more concerned about not if you're stuttering, but how you're stuttering, right? And when you stutter, are you able to enter that moment of stuttering without, like, escaping from it, without backing out of it? Are you able to move through that word without a lot of thinking about how to move through the word? Are you able to say the word without a lot of physical effort? Because really struggled stuttering is not spontaneous speech. And I don't think that would be any person who stutters idea of successful therapy, right? And so this isn't my prioritizing spontaneity is not to say we shouldn't work on our speech. Is to say that what's important when we work on our speech is not fluency, but effort and attention, right? And if we can reduce the amount of effort and attention that speaking takes, if we can stutter more easily, if we can lose control less dramatically, or even keep control through a moment of stuttering, that will be more spontaneous and therefore have less negative impact of stuttering on our lives.
Yeah, exactly. I think that was a good explanation about that. Because yes, indeed, it doesn't mean that you're not working on that. It's just the focus is not fluency. Also, because research has shown us that the focus on fluency in stuttering therapy is not like doesn't bring us long-term results.
Yeah, I think the research is really strong, actually, that if you do these techniques, you can speak fluently, but that long-term, it's not viable, right? It's really hard to use these techniques all the time, right? And that they sort of require constant practice and constant attention.
Yeah. And I mean, I think we both agree in the idea that, the people is free to choose, but what we want to promote in therapy is for that person to speak freely and without the less effort possible, just to speak. And again, time flies. But yeah, I think it was like a nice explanation about it. I feel like just 5 minutes, but it's been like 20. So well, thank you so much for your time, and well, until next time.
All right, I love talking to you. Thank you.